Welcome to SG Health and Wellness guest series. I'm Swati, Doctor of Natural Medicine and Holistic Nutritionist from Minnesota University, Australia. We have the privilege of speaking with Dr. Ajitabh Srivastava, a renowned hepatology surgeon with over 18 years of experience in treating liver diseases. Today's episode marks the second episode in our 5 episode series with Dr. Srivastava. The first episode in this series dealt with fatty liver. Dr. Srivastava is here to help us further explore the topic of liver cirrhosis and discuss the treatment options in detail. So stay with us until the end so you don't miss any valuable insights. Dr. Srivastava, a warm welcome to SG Health and Wellness.
Thank you, madam. Thank you very much.
Today's episode is all about liver cirrhosis part 1. Can you please explain what is liver cirrhosis and how does it develop and what are the main causes of this disease?
So, liver cirrhosis is a terminology given when the liver becomes shrunken, fibrosed, becomes hard, the surface becomes irregular. Okay, and it is a form of delayed part of a response of liver to injury. So let me explain what exactly it is. So what happens is that like any part of our body, whenever there is any injury, like it heals in the manner of deposition of fibrous tissue. So in the same manner, like for example, a cut in our skin, which is everybody is aware of. Okay, anybody getting a cut will heal in the form of formation of a scar. In the same manner, cirrhosis is like a scarring of the liver. Okay, so what happens is that with ongoing inflammation in the liver, uh, the liver starts to try and overcome this insult, which could be because of various reasons. Okay, so it would start with an inflammation stage of inflammation. That inflammation will be progressed to the stage of fibrosis, and that fibrosis will start having, like, the liver will start, part of the liver will start growing, part of the liver will become because of the scarring will become more shrunken. So then what happens is that in that manner the smooth surface of the liver is changed to a nodular surface, because this is a form of certain part of the liver will be trying to regenerate some part. So this, there will be a structural damage to the liver, and that is what is known as liver cirrhosis. So in short, it is a scarring of the liver. Now, coming to your next question, why does it happen? So it happens mainly because of the response of the liver to the ongoing damage which is happening to it. Okay, so the structural damage is a sort of a healing process within the liver. And the causes of it, there are multiple causes for development of the liver disease, but the most commonest what we know of is where we know the cause of the liver disease is first of all is non-alcoholic fatty liver disease or metabolic associated fatty liver disease. Okay, which is seen in patients who are diabetic, who are obese, who have other endocrinological problems like hypothyroidism, or who are taking steroids. The second cause is alcoholic liver disease, because of long-term consumption of alcohol. This alcohol causes the similar process in the liver, where there is fat deposition followed by inflammation, and then the same process of scarring and cirrhosis. The third cause is because of viral hepatitis B and C. The commonest, which a lot of people may have suffered during their lifetime, is by hepatitis A and E. Okay, so hepatitis A and E, because of its nature of injury to the liver, and it is very transient, it only happens for a short period of time. Okay, it doesn't lead to any development of cirrhosis in the liver. Okay, whatever healing happens because of hepatitis A or E is without fibrosis. It is a normal healing of the liver which happens. But when we talk about viral hepatitis, it is mainly hepatitis B and hepatitis C. The fourth cause is when the body's immunity doesn't recognize its liver as its own liver, which is known as autoimmune hepatitis. So, because of which the similar process of inflammation and all other cascade goes on. The next cause is, say, patients who do have, say, maybe iron deposition or copper metabolism derangement, because of which this heavy metals get deposited in the liver, and that causes an insult and injury to the liver. Okay, then you have the causes could be across the counter, some medication, some drug induced liver injury. Okay, some medications, steroids, some other medications over the counter, which like say it is seen that some preparation like Ayurvedic preparation and all, where which have heavy metals, they do have their they cause damage to the liver, and that damage to the liver can further progress to liver cirrhosis. In a good number of patients, maybe 20-30% of patients, we may not be able to identify the etiology of the liver
So, what are
disease.
the early signs and symptoms of?
See, the signs and symptoms. So, for that matter, liver cirrhosis can be divided into a stage where the liver cirrhosis may not cause any overt symptoms. Okay, where it is considered to be in a well compensated state. And the second group, when the symptoms come in because of liver cirrhosis, it is considered as a decompensated liver disease. Okay, so, but in a large majority of patients, the commonest symptoms, which is firstly seen, is say feeling weakness, fatigue, loss of energy. Because whatever said and done, this change in the liver, where there is a cirrhotic change happening in the liver, it drains out lot of energy from the body. And so the commonest symptoms where a person may feel that he is losing his interest, he's losing his energy, and he's not able to do the work the way he was able to do in past. So anytime any symptoms like this come in, then it is important to get the full body checkup done, in which the liver also would be assessed to see whether there is any liver cirrhosis.
But these all are the causes or symptoms of other
Multiple
liver diseases
problem.
also.
Yes.
So,
Other
how
liver
can
disease.
they differentiate between that other liver diseases and the liver cirrhosis?
See, liver cirrhosis is a body's response to a injury to the liver. So the other causes which we have enumerated, they cause an injury to the liver, and that injury to the liver progresses to cirrhosis. Okay, so cirrhosis per se will not have any symptoms. Okay, say if a person has got a liver disease which has not progressed to liver cirrhosis, but the process is the same, where there is an inflammation in the liver happening, there is some degree of injury happening to the liver. That injury to the liver will be responded in the form of healing, which the liver would like to do. So all this process of inflammation to injury to healing will take up lot of energy from the body. Okay, so the commonest presentation for anybody having a liver problem would be loss of energy, feeling fatigue, not able
Appetite
to do,
also.
loss of appetite may not be. Okay, but many a times some of them may complain of some loss of weight, which is not very characteristic, because one of the commonest cause for liver disease is a person who is on the heavier side, who's obese.
Okay.
Okay, so loss of weight, loss of appetite may or may not be there, but first is the fatigue. Now coming to the symptoms pertaining to when the liver cirrhosis become decompensated. Say, as I mentioned to you, that a patient may have liver cirrhosis but may not have any specific symptoms because of liver.
Mm.
When I say specific symptoms because of the liver, which is commonly known to our general public, is presence of jaundice, okay, because of inability of the liver to excrete bilirubin.
Mhm.
Some patients may have water in the belly, which is ascites. Some may have confusion where mind may not work as well because of, again, non because of the liver not functioning very well. Okay, some may develop kidney problems because of the liver disease. So all the symptoms which come in, they come in when the liver is more than 90% damaged. And they are a warning sign that now the liver is damaged significantly, where action needs to be taken in the form of maybe to the tune of needing a liver transplant. Okay, so what I will like to tell to our viewers is the symptoms of liver disease or liver cirrhosis, which is jaundice, ascites, hepatic encephalopathy, or HRS, hepatorenal syndrome, or development of variceal bleed, GI bleed, where they may vomit blood or pass black color stool. So these are all symptoms of advanced liver disease, which is termed as a decompensated liver disease.
And who is most at risk of developing cirrhosis? Any particular age or
No, liver
no?
cirrhosis is known to see is seen in even pediatric age group
Oh,
to extremes of age. Okay, yes, as a person age, as a normal wear and tear of a liver, or as when normal wear and tear happens of all the organs, in the same manner with age, liver also may develop a damage. So those are, yes, higher age group may have a higher incidences of say liver cirrhosis or maybe some derangement in the liver structure. Now, who are the risk factors to develop liver disease? Anything which is any factors which are known to damage the liver, as I enumerated the causes of the liver disease,
correct.
where a person who's fat, who's obese,
Obese
who's
or
diabetic, who's
right.
hypothyroid, who's taking
But why
steroids.
pediatric then?
Yeah, I'll tell pediatric causes of pediatric liver disease.
Mhm.
Then the other patients who are at risk of developing liver cirrhosis are patients who know that they are hepatitis C or hepatitis B positive,
Correct.
or a person who has a tendency of autoimmune pathology in the body. They may have autoimmune hepatitis or PSC or PBC, which is all clusters of autoimmune liver disease. They may be at a risk of development of a liver cirrhosis. So anybody, say, who has, say, risk factors of development of a liver disease should get themselves screened on a regular basis for them checking whether liver cirrhosis has set in or not. Now, coming to your question on pediatric age group.
Correct.
Okay, yes, liver cirrhosis or liver disease is seen in pediatric age group. By itself, the most commonest cause for development of a liver disease or liver cirrhosis in pediatric age group is mainly, like say, when I say
Genetic.
talk about patients or pediatric age group who are needing a transplant, the commonest indication is patients who do have a developmental anomaly where the bile duct development is affected, and they go on to develop a entity known as biliary atresia, and this is one of the commonest cause. There are other lot of other causes of pediatric age group, and many a times it is enzyme deficiency, or it could be some genetic issues with the patient. So there are number of causes for liver disease in pediatric age group. Now, yes, you did ask what is the role of genetics in the development of liver disease, say in adult age group. What I would say is, yes, definitely there is some role of, say, if anybody has in a family who has had a liver disease. Okay, so it's important that other family members also get themselves regularly screened for whether they also develop a liver disease or not. Because many a times, as I mentioned to you, say in 15 to 20% of patients, we may not exactly know what is the cause of the liver disease. Okay, and where I think so, maybe somewhere genes or the genetics may play a role, where there are certain factors which we in medical field have not been able to identify. Okay, but there must be something baseline which is happening where the genes may have some role to play and they may develop a liver disease. Yes, I will always feel that genetics do play a role in development of a liver disease. For example, there have been so many times there are patients who come to my clinic and they complain that I do take alcohol, but my friend takes more alcohol than me, but he has not developed liver cirrhosis. Why have I developed? Okay, so the answer to that question could be that somewhere maybe his genes are in a manner where even the smaller amount of alcohol which he was taking was harmful for the liver for development of liver cirrhosis. Whereas his friend may be having a better genes where they it must be metabolizing alcohol in a better manner, and hence he may have not developed a liver disease in spite of taking more alcohol.
More alcohol.
Yes.
Correct. And what are the different stages of liver cirrhosis?
See, liver cirrhosis, it is the stages is first as the liver disease progresses. It progresses from fatty liver to inflammation, which is known as steatohepatitis. Then it goes to the stage of fibrosis, where they may develop F1 to F6 fibrosis, up to F3 fibrosis. If a corrective measures are taken, the liver has not developed a structural damage.
Okay.
Beyond F3 fibrosis, then the structural damage is permanent, and this further progresses to cirrhosis of liver. Now, coming to your questions on what are the types of cirrhosis. So, the cirrhosis, as I enumerated, it could be either a compensated liver cirrhosis or a decompensated liver cirrhosis. Compensated liver cirrhosis means that liver is cirrhotic, but the body is somehow coping with it and has not developed signs of liver failure.
Okay.
Once the symptoms come in, which means that now the liver has developed enough damage where now it has started showing symptoms.
What complications can arise from it?
Liver cirrhosis, yes. Liver cirrhosis, as you see that this is the structure of the liver which is smooth. This is a structure which is become shrunken. So the blood, liver has got dual blood supply. It has got a portal vein, it has got artery. This portal vein, it supplies, like it drains the blood from the abdominal organs to the liver. From the liver, blood goes to the main vein of the body and goes to the heart. The heart is sitting here. So when the structure of the liver becomes irregular, okay, like say I will tell you that, say for example, if a river is flowing and you put a dam, like if you construct a dam in the river, what happens is that the flow beyond that dam, wherever the obstruction, it becomes very feeble.
Correct.
And the part of the river before the dam will start accumulating water. Okay, that water will start going to its destination by some other route.
Correct.
Okay, so it would form either canals or rivulets, and then it would start draining to its final destination. In the same manner, when the blood flow from the liver is obliterated because of the structural damage to the liver, there are abnormal blood vessels which start growing, which are developing as a collaterals. So these collaterals can go through various part of the body, and some of them go through the intestine gut, where this present as a varices. So one of the complication of liver cirrhosis is this varices can rupture and can cause massive intestinal bleed. Okay, so the first symptom. The second symptom is again because of the structural damage to the liver, there is portal hypertension, secondary to which there would be water which will start exuding out into the abdominal cavity. So a patient may develop ascites, which is water in the belly. Okay, once the liver functionally is not working well, then it will start the excretion of bilirubin from the liver is affected, and a person may have elevation of the bilirubin level, which is known as jaundice clinically. There is yellowness in the eye. Then because of the liver is a chemical factory, like, and it is known to produce lot of important substances. The proteins which are important for various body functions in our body is manufactured by the liver. Okay, once the protein once the protein say production is hampered, then it leads to say swelling because the body starts retaining fluid. So this could be another cause for development of ascites, swelling in the leg. Okay, then patient, because the some of the proteins help in the clotting of the blood. Okay, if those proteins are not produced, then the clotting of the blood of a patient gets affected, and a person is prone for bleeding because of incomplete clotting of the blood. This portal flow, it drains blood from the spleen. The spleen is sitting here. Once there is an increased pressure in the portal flow, the spleen starts increasing in size, because of which patient may start developing a low platelet count, and this also could be one of the factor where the bleeding may be at a higher risk. Okay. Then the other complications are, say, a person who has got a failing liver or has a liver cirrhosis. As I mentioned to you, that it takes a lot of energy out of the body. Patient may start showing features of, say, protein loss. They may start losing their muscle bulk. They may start losing their arm circumference. They may become more weak, frail. So there would be a time as the liver disease progresses, they become like they have a pot belly and with thin limbs. So that is how it progresses, and it is a slow killer. Liver disease is a slow killer, and slowly a person will start seeing deterioration in his general health, and there would be a time when slowly the liver disease will succumb him.